Hi, everybody. This is Cody Blue. I'm over at Ivy Rehab in Winfield. I also have my colleague Matt Lesniak, who's in the Crown Point location. And today we're going to be talking with Dr. Omar Perez. He's an orthopedic physician based with the Gary Railcats. He's affiliated with Methodist hospitals. He's also affiliated with Northway Orthopedics. So thank you, Dr. Perez, so much for taking some time out of your day and chatting with us for a little bit. We're going to talk about some athletes, some shoulder problems, some knee problems. So thank you very much for your time.
No, thank you, Cody and Matt, for having me. It's a pleasure always, working with you guys. I know we have a very good relationship, taking care of the patients around the Northwest Indiana area, and we're here just to educate and spread the word out there that there's a good quality care in this area. And it's good for all the public to know that we're here to help.
Yeah, definitely. There's just some uncertain times, just kind of getting on the tail end of the COVID-19 pandemic. So for the viewers that haven't met you yet, can you share a little bit of information about your background? How you came to Northwest Indiana. You've been all over the country and Puerto Rico. So can you share a little bit about that with us?
Yeah, so I'm born and raised in Puerto Rico. I did an orthopedic residency over there. Then I came to Houston about 4 years ago, where I trained in Baylor School of Medicine. I did my sports medicine fellowship over there. And over there, I was exposed to, a lot of high elite athletes. I trained with cover sports for the Texans, the Rockets, MLB with the Houston Astros, and I did some NCAA Division I coverage as well with the University of Houston Cougars. And then also I had exposure to high school athletics and kind of a very well-rounded program. And then one time I visited the area. I was around Chicago. I like the city. I personally live in downtown Chicago. But then I saw that there's a niche here in Northwest Indiana to create sports programs, specifically in high school. One thing that I noticed as soon as I got here, I was with the mentality that I wanted to be part or develop specific sports medicine program for high school athletics. And I found out that it was very, the area wasn't used to that type of dynamic. So I brought whatever I learned from Houston here to Indiana. And so far, initially worked with Methodist hospitals. We have an affiliation with the Gary Railcats, Maryville High School, and Calumet High School. And I also have an affiliation with community hospitals, where we take care of the population here in Monster as well. Most of my practice, or a high percentage of my practice, is shoulder surgery. I do a very complex shoulder surgery. Being a sports medicine trained surgeon, I do all types of arthroscopic surgery, minimal invasive surgery for the shoulder, knees, and hips. And also I see a lot of sports related injury, whether it's a high school athlete, recreational athlete, your average weekend warrior. Everybody likes to do something, especially now that the weather is warm. So I see quite a few of those injuries. And then that's basically what my practice is based on.
Great. Yeah. Well versed. So take me through, if a patient comes in and saying they're having shoulder problems, what are some treatment options that you would maybe share with them, or maybe some groundworks that you would kind of look into before making a decision?
Yeah, sure. In orthopedics, specifically in sports medicine, I see a lot of injuries. Let's talk about the shoulder. That it's more degeneration of the joint. It's more overuse. So it's a kind of injury that has a slow progression over time. And in that case, when a patient says, I've been hurting, my shoulder has been hurting for a while, didn't think much about it in the beginning, but now I'm not able to do the things that I want to do. I can't play with my kids. I can't, mow the lawn. Those type of things get affected. Then it's very important that we try conservative measures first, okay? Because most of the overuse injuries respond well to conservative measures. What do I mean by that? Physical therapy or a physician-directed home exercise workout to strengthen the muscle, improve mobility. And also, if patient continues to have pain, there's also other modalities that we can do, such as injections. Most people know about the famous cortisone shots. So that's some of the tools that us orthopedic surgeons have to provide some pain relief, some comfort for the patients so they can do their activities of daily living. And then a fraction of those patients that don't get better with conservative measures, 3-6 months have gone by, they've tried therapy, they've tried injections, they've tried medication and still don't see any improvement, then we need to dig down, do more studies like MRIs to find out what's the real problem. And those are the kind of patients that become surgical candidates at some point after missing, failing conservative treatment.